All right, friends, let's talk about a case. So you have a patient who presents as very confident, almost overly confident. They speak very highly of themselves, their achievements, and their abilities, and they expect others to recognize it without a question, right? In their relationships, there's also a pattern. They struggle with things like empathy, and they often dismiss other people's feelings, especially when it doesn't align with their own need or even their image. They can be very sensitive to criticism. Even small feedbacks can feel like a personal attack to them. And when that happens, you're gonna see things like defensiveness, withdrawal, or even anger. They also need to prioritize being admired. They want to be seen. They want to be validated, sometimes even elevated above other people. So what do you think this diagnosis might be? The most likely diagnosis is narcissistic personality disorder. Narcissistic personality disorder is characterized by a deep pattern of grandiosity, the need to feel admired, and lack of empathy. But there's a part that people don't always talk about. Underneath the presentation of these things that I mentioned, right, there's often a very huge, fragile sense of self-esteem that's happening. So what looks like confidence, honestly, it's really being blanketed and covered up by deep insecurity. So from a treatment perspective, things are gonna help people that have narcissistic personality disorders. Is gonna be psychotherapy, because it helps them build insight, helps them to develop healthier relationship patterns. And as clinicians, it's important that we don't just label the behavior, but we take time to understand that there is literally a person that's behind this.